Hi, my name is Ben Fischl. I'm a D1 at the University of Iowa College of Dentistry, and this is my final project for Cariology. It's titled Caries Risk Management, Factors, Rationale for Occurrence, and Prevention. Julie, thank you so much for asking your question. I have to say, a lot of people never take the time to stop, be humble, and consider what could cause cavities, and I really appreciate you giving me an open door to talk more about this with you. Believe it or not, I took an entire class on cavities my first year of dental school, so I feel prepared to discuss this after the many hours that I sat in a chair talking about factors that you never would have thought of. But let's get into this topic. To answer your question, I'm going to break it into three different parts. And first I'll say that often when I talk about cavities, I'll use the word caries because caries is the underlying disease that eventually can lead to cavitations or cavities in teeth. It's actually starting way before it gets to the point where I need to put in these fillings. So the things I'll talk about are factors that contribute to extensive caries, how I think these factors may have contributed to you individually, but also we'll talk about that question about how we could possibly minimize the potential for your future family to have cavities. I'll break down the factors that impact caries into four parts. The first one I want to talk about is diet, because I think it's the one we have the most control over. Overall, our diets, if they're carbohydrate rich or if they include frequent snacking, they can cause an acidic environment where over time a bacterial dysbiosis occurs in our mouth, and the diets can lead to demineralization of our tooth enamel and eventually cavities. The next one would be oral hygiene. If we have poor oral hygiene, it allows that accumulation of plaque, which again creates an acidic environment where our teeth are more susceptible to erosion and cavitation. Fluoride is something that can strengthen and reverse that demineralization. It's something that we can take in our toothpaste, in our water, and even topically at the dentist. And on that topic, access to dental care. It's very important to have regular reoccurring dental visits that aren't just occurring when we have serious problems. The next factor would be microbial and genetic factors. There's a bacterial dysbiosis that is present when there are a lot of cavities. It's something that we can have some control over, but there's also genetic factors that we may not be able to have control over, so I won't get into that topic too much. And then lastly, behavioral factors, most notably smoking. If we have certain behavioral factors like smoking in our life, it can cause a much larger risk for cavities. When it comes to your individual experience with cavities, I would say that four of the things that stand out to me is that you said you grew up in a rural town with no water fluoridation. It's not something you had control over, but I think it certainly contributed to your experience. You also shared in your health history that you do like to smoke, while not every day when you're out with friends. Any amount of smoking can increase your risk, and so I would encourage you to consider quitting. The fact that you have prior cavities actually is a large risk factor for future cavities. And lastly, you shared that you do love to frequently snack, and that's something that you could definitely change to lower your risk for more cavities. When it comes to your family and minimizing their risk for cavities going forward, I'd like you to focus on three of the four things I talked about earlier. I don't think you can really change the microbial and genetic factors a whole lot, but you can really change the diet, how often you're snacking, and what you are snacking with. The oral hygiene of your family is something which you can have a lot of impact over. Make sure you have proper exposure to fluoride, and I'd love to make sure that you're seen here every 6 months. And lastly, the behavioral factors, the most important being smoking. And make sure that you and anyone in your family considers very carefully how much smoking can impact the risk for cavities. Thank you again for your humility in asking this question, and I'd love to continue the discussion more with you if you'd like me to clarify anything. Thanks.